and privileged to welcome you all for our 11th webinar of the series of the Empowered Nurses to Empower Nurses. All of you know that this concept of this program, it is not just like, only the educational perspectives. It is a kind of sensitization of nurses. We all know that the nurses are doing today very excellent, the services to the community, even during the COVID. But all are today acknowledged and visible in this society. And still we are as TNI and different forums are working for bringing this better system for the nurses at par with the other countries, developed country like US and other countries. But still we have to motivate each other, and self-motivation is the one which makes changes other than what motivation or sensitized kind of this type of programs. With this concept only, we started this Empowered Nurses to empower nurses. The empowered nurses, what today we are seeing this, the two eminent, speakers, like my teacher and great mentor in whole Tamil Nadu and India, Professor Jaya Madam. Her service was excellent. We are going to see her CV, then you will realize. I am lost 25 years in journey of my professions. I can note down that many, I have gone through my teacher and senior people. She is one of the most important person in my professional life to change and made me to be very visionary. And today also I am part of the TNI because her role is very tremendous. It is my proud moment for me to invite her and to talk about this compassion about the nursing to improve the quality. It is not only that we show the quality of nurses and change the quality of the care which is required today. And again, another eminent, speaker, that is very young and charm and energetic, Diane Thomas. I had lost 10 years of my experience to there as a student to today. Her tremendous role today, that what she's contributing, that she's going to express, and also she is the secretary of the Society of Cardiac Nurses. She lifted the cardiac society nurses in the very different manner with the energy and her compassion. So I'm it is again, and also we have our chief guest, Annie Madam. And everyone know that she is a national leader, and her vision, which motivation, and continuous support only we are able to do this type of program and activity. And today the Delhi branch is alive because of her continuous support and the constant and continuous support, which is be able to make it the changes today what we are doing. So I now once again welcome you all for this wonderful session. I'm over to Saini.
Thank you, Dr. Gopi. Next, moving to our next program, it is the special address by Mrs. Annie Kumar ma'am, who is the Vice President of North Region Trained Nurses Association of India. She is a very ever charming, enthusiastic leader. And under her guidance and support, as Dr. Gopi said, we are working. And over to Annie ma'am for the special address.
A very warm good morning to you all for this sunny day. Even though we are all indoors, we can still enjoy looking outside and see the bright sun. So a very good morning to all of you. I am very glad to be here in front of you all. And it's a proud moment for me to be here to address the 11th webinar, which the Delhi branch is conducting. Even though the system or the environment is not very conducive for learning, still it is very proud to say that Delhi branch is conducting so many webinars which are very educative and very effective for the nursing community, for the nurses, for the practicing nurses, as well as for nurses of all sessions or all areas, those who are benefited with your empowering nurses by empowered nurses. And they are, I know, identifying the empowered nurses from all over the country, all over the India, to address this webinar so that our Delhi nurses are benefited from experts from all over the country. I acknowledge your contribution and your leadership with Dr. Gopi Chandran as the president of the Delhi branch, Shaini as the secretary, and the team, the complete team is to be congratulated for your efforts which you are carrying out. And you see that it is the 11th webinar. And proudly I can say that all the topics which are chosen for these webinars are of great importance for the clinical nurses and nurses of all the areas, even for the student nurses, because so many people are telling me that we are highly benefited with these webinars. So especially today, I welcome the experts, Professor Jaya and Mrs. Dani Thomas, who are the experts who are going to deliver, especially about the compassion, which is everybody is crying. Nurses, compassion is not a very which is a very important quality, but still it is not expressed everywhere because maybe of various reasons you can say that they are very busy, there is time limitation and there is workload, but we cannot take any excuse for not showing compassion towards the patients and to their relatives. So I hope that this session is going to benefit all the nurses. Even I am going to listen to the session because I know that the experts are going to deliver their knowledge and their skill for all of us to follow. So I welcome everybody, all the participants who are taking time to be here to listen to these important and these very effective and very knowledgeable sessions, which is arranged by the Delhi branch. Again, I congratulate the leadership of the Delhi branch, TNAI, which are doing a very great work during this pandemic season also. Okay, thank you and welcome everybody again to this session. Thank you.
Thank you, Annie ma'am, for taking out time and thank you for your encouraging words. Next, I would like to introduce today's eminent speaker, Professor Dr. N. Jaya, who has done her RN/RM, BSc Nursing, MSc Nursing, and she also has done her PhD Nursing. And she has done her MA in Sociology. Ma'am is currently working as a Dean in Shenbaga College of Nursing, Chennai. Let me just list out the experience and achievements of ma'am. She has a professional experience in teaching, research, and clinical practice over 40 years. She is an expert and resource person in national and international forums. She has held reputed positions in various boards and committees of Dr. MGR Medical University, Tamil Nadu. Ma'am is also authored textbook for vocational nursing in +1 and +2 in Tamil Nadu state. Madam is a coordinator, the CAMT and Indian-Sweden project in 2009, Madras Medical College, Chennai, Tamil Nadu state. She is also the state master trainer in 2008 to 2009. And Madam has published research papers in national and international index journals and presented papers in national and international forums. A few things about Madam's awards and honors. She has received the Best Nurse Educator Award in 2015 from Education Today, Best Nurse Award in 2005, TGNA, Best Teacher Award in 2011 from the Tamil Nadu Dr. MGR Medical University. She has received the Lifetime Achievement Award in 2012 from the Tamil Nadu Dr. MGR Medical University, and also Lifetime Achievement Award 2021 from the Tamil Nadu Nurses and Midwives Council. So today we are happy to ma'am as a speaker, and ma'am will be speaking us about compassion in nursing, a positive approach for the quality care. Over to Dr. Jaya.
Thank you, Madam Shaini, for a nice intro. A very good morning to everyone. First of all, I thank the beautifully integrated minds of TNA headquarters, the National President, Dr. Roy K. George, Secretary General, Madam Evelyn P. Kannan, Vice President and Northern Region, Madam Annie Kumar, and other office bearers of headquarters, and TNA Delhi branch, the president, Dr. L. Gopichandran, the visionary leader of the present days, Madam Shaini, Madam Bindu, Madam Dolma, and other office bearer of TNI Delhi branch for giving me this opportunity to be a part of this 11th webinar on empowered nurses to empower nurses. So this concept of empowerment is just not only the individual who is empowering themselves, or it is the power or the empowerment, the empowered nurses are enabled to identify others' strength and abilities and also be confident in their life and come up in profession. Thus, this type of concept has been very much valued for the present day. And as Dr. Gopichandran said, the vision of bringing nursing the higher level of status. So here, I just want to say, and I take this opportunity to congratulate Dr. Gopichandran and team for receiving e-governance award for adding pride to nursing profession and make every one of us feel proud. So one individual award is not restrained there itself. It brings changes among the youngsters and it brings the profession to a higher level. So just I want to share, there is this incident which touched my heart and still I remember it fresh in my mind. It was during my holidays after my graduation when I was in my native village. A neighbor had come seeking me help for a baby who had been just born at home, saying no sign of breathing. I immediately rushed and revived the baby, and at that moment I felt myself being a nurse and was very happy to be a part of nursing profession. In turn, it empowered me to become a nurse in the specialization of midwifery. So the empowerment, I was not knowing that it is a term as an empowerment, but it gave me a pride and gave me energy and it made me solidarity in my profession. So this type of empowerment also helps to build up nursing. In long run, we get into various programs and developments in nursing. Say at the same time, when I just I just want to say, last week we had the virtual conference of SNA Biennial conference at last week, which recalled me in my student period. I have been as an active part of SNA member during my student period. I have attended 2 national SNA conferences, one held at Indore in 1973, Madhya Pradesh, and another one during my 3rd year in Baroda, 1975, Gujarat. So that conference gave me a valuable insight for shaping myself in the profession to lead and take part in association activities, which is in turn bringing up the profession. So actually, when I just want to say, seeing these deliberations of SNA students, I really do believe and have confidence the future nursing of India is in the safe hands of the young, vibrant, aspirant, ambitious generation. I really want to say, as because of these things, we will be highly motivated. So, which helps us to go for enrolling TNA members and so on. And I have been established SNA units And even I've been one of the founder of Postgraduate Nurses Association. So association activities also helps profession to come up. So with this, I just want to go and say one word, that time and again, this pandemic shows nurses are the frontline warriors and save the millions. And every nurse throughout the global is a blessing in disguise of Florence Nightingale. The present scenario of global nursing has tied the thread of compassion. So compassion is one which every professional is now bringing and executing. I just can you see my screen?
Yes, ma'am.
Yes. Just a minute.
Ma'am, are you sharing or will TNI headquarters share it for you?
Yes, I can share.
Okay.
If it is okay, then you share. If it is.
Now you can share, ma'am.
Can you?
Yes, it's audible. We can see it. It's visible.
Ready? Can you see my screening?
Yes, ma'am, we can see.
Yeah. Yes. It's not moving 1 minute. Slideshow. Yes. Wisdom, I just start with, sorry for the interference. Wisdom without compassion is ruthlessness, and compassion without wisdom is folly. Fred Kaufman. Learning from the top thinkers and care provider at the forefront of evaluation, focusing on the outcome of quality care, depends on the satisfaction of recovery of illness and emotional well-being of patients. So when we go for meaning of this, compassion in nursing, compassion is defined as the sympathetic consciousness of others' distress to alleviate. And basic, the basic nursing lies. The basic nursing lies on the compassion, care, respect for the frail and sufferers. Hence, compassion is described as the moral obligation imposed on nurses. The role of compassionate behavior has an effect on patients under care. Nursing influences individual in such a way that human potential is used for maintaining and promoting health in a safe environment. The only profession which the human potential has been fully utilized for the promotion of health. Compassion is an indispensable part of nursing and patient care. So when I go for compassion, I just take these three aspects of compassion, which said as dimension of compassion, compassionate care, which has been provided by the healthcare providers. The receiving end are the patients, receiving compassion by patients, and which has been again compassionate leaders extending compassion, That means the managers, supervisors are extending compassion to go for compassionate care. The same way, the compassionate care has been provided by nurses. The nurses are care providers and they have to have self-compassion. With all this compassionate care received by patients, provided by nurses, and extending and coordinated by the managers and supervisor, brings out the quality of care. Need for compassionate care in nursing. Why we need compassionate care in nursing? As we know, we are already having all the inputs of nursing virtuals. And here, professional behavior in nursing includes honesty, integrity, compassion, altruism, listening skills, excellence, and multidisciplinary working. Healthcare is the effort made to maintain or restore physical, mental, and emotional well-being by professionals. Compassion is a virtue and necessary trait of nursing and being a nurse. Compassion nursing care leads to higher satisfaction in patients, safer care, saving time and cost, a sense of satisfaction and trustworthiness in the personnel, high confidence and coping skill. Compassion also said as intelligent kindness by professionals and central to patients' perception of care. So when we go for this values of nursing, as we know, previously we used to say that foundation, fundamentals of nursing, principle and practice of nursing, now foundation of nursing, all the changes which is taking place in nursing also based on these core values. The core values are shared within the global community and they are reflection of human approach to the nursing profession. As I said, compassion, honesty. So every one of us will be knowing the top honest profession is nursing. So this type of trustworthiness gives confidence to the patients who are receiving care from nurses. Altruism, autonomy, social justice, and integrity. These are all the core values which we are exhibiting or executing in all our care part of it, wherever it is, whatever it is. So compassion, a positive approach. Treating and caring with compassion is a powerful way to influence health and is reshaping the way and quality healthcare. Compassion can improve staff efficiency by enhancing cooperation between individuals and teams, between patients and healthcare professionals, and helps to prevent health problems and speed up recovery. That we have witnessed in this pandemic, how nurses were cooperating and coordinating to provide the optimum care for the patients who are suffering with the COVID-19. So compassionate care behavior in nursing. So we have certain sets of nursing behavior, professional behavior, and we have our own science and technological advancement which guide us to have all sorts of inclusion of the science into our nursing. With all that, again, too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. As said, here it is important for us. So whatever the facilities been available with the collaborative care, with the evidence-based care, with the scientific care, everything, but still a nurse has to show compassion. So that will bring a change in the patient's mind and acceptance for the care. Practice good manners. So here it is very important. It may look very simple, but still because of the workload and because of the environment, nurses are very much interacting with one another and bringing all the possible care for the patients. Still, they practice good manners of being polite, being calm, and this particular manners helps them to develop a confidence on the nurses or the care providers. Show personal interest. So when we are just going for taking something, collecting history and other things, it also helps us to go in the way in which we just to recognize the patient when they are wearing some thing which is being very specific, and start slowly the conversation so that the individual will develop confidence over that, so that they will reveal and the interaction will be a positive way to get things done. And think and realize the needs. So we have to think and realize the needs. Here it is very important. Everyone has a unique need. We can't go and apply for the common thing for individual. So we have to understand and realize through compassion, we'll be able to identify these things and we can have a better quality of care. Acknowledge their feelings. Yes, here we have to acknowledge. Whenever the patient says something, we should not say that I know, and yes, I know this, I know this. No. Yes, I can understand your suffering. I can understand your feeling. So these are certain things, again, I just want to say, helps the patients to have confidence over their care and care of one's own emotional needs. This is very, very important when you want to practice compassionate care, and you have to have your own emotional balance should be maintained. How to maintain our own emotional? By understanding the environment, by understanding the level of our emotional needs, and we have to cope with ourselves, then only it is possible for understanding others. So the essential skill for compassionate care in nursing. Here we have certain skills. Yeah, everybody have intelligence skill, emotional skill, and all sorts of skill, communication skill, soft skill. Every skill is there, but still we have to have certain basic essential compassionate care has to be delivered on this important aspect of these skills, especially emotional intelligence. What do you mean by emotional intelligence? Strive for higher emotional intelligence to handle interpersonal relationship with workers and patients. So that means we have to understand our own emotion, we have to understand others' emotion, and that emotion has to be balanced, and it will also help them to realize the need of the individual, which will to relieve the sufferings and to help their sufferings and bring out changes in their life by providing nursing care. Then again, resilience is another skill a nurse has to practice, a nurse has to acquire. Maintain personal resilience through participation to explore personal values and others' perspectives. That means if a nurse who have been having some problem and she's not in a position to overcome, but because of this essential skill of compassion makes the nurse to come back to her and bounce back to her normal balance of emotion, so that again makes her to continue with her quality of care to her patients. Here again, that also should be understood, and it also should be made to the individual and help them to go back to their normal life. Critical thinking, the ability to think critically and solve problems quickly results patient satisfaction and care. This the special skill, especially for nurses, are critical thinking. So we can just to say, when something happens on a hurry with work overload, the nurse is there to help and think and make the atmosphere very conducive to proceed with the care. And cultural awareness. Maintain cultural awareness as it relates to patient-centered care. Knowing the patients well enough to determine the cultural views can augment the nurse-patient relations in a positive way. So this cultural awareness, the cultural diversity is there, but still nursing is one. But as a nurse, we have to practice and understand the different culture, values, and customs of the patients. So that will in turn help them to have a better relationship with one another and contributes for a better outcome of the care. So confidence, the ability to communicate any instance abatement in quality of patient care and to discuss issues confidently to peers and leaders. So when in the care arena, when we are taking care of individual, something happens, anything, it can be on any adverse effect or whatever it is during the process of our care. So a nurse should be confident enough to tell the actual thing which happened on the care, and she has to share her experience to the peers as well as the leaders, so that that particular situation will be known to others, so that they'll get experience and they will get their knowledge to overcome that type of situation. So any nurse has to have this confidence in dealing with relatives, patients, and caregivers. Coordinate with other collaborative care, other team members. So the communication also is very important, which brings confidence. So here, we just want to say, so when as nurses, when we are providing compassionate care, so we need someone for us to help, or for us to appreciate, or for us to correct, and for us to supervise. So here, the compassionate leadership plays an important role, and every nurse, when they have the problem in any working area or anywhere, here the compassionate leader comes to take care of her as patient care provider and help her also to get that particular situations to be overcome. So compassionate leadership. The compassionate leadership can be defined as the ability to take oneself, individuals, teams, and organizations to a higher level of performance and will be well-being in a safe and stimulating way. So here, when we mean this one, the compassionate leadership, having the quality or the ability to take care of oneself. So when we are working in a place or in an institution in care providing setting, then the leader herself to have all the ability to become herself higher and helping the individuals working under her, teams and organizations to the higher level of performance, that will in turn help for a safe and secured way of care to the patients. And very well, this compassionate leadership brings changes. Compassionate leadership is a willingness to and desire to be kind to others. It means being thoughtful and aware of what others experiences. So that is the important thing which the compassionate leadership carry over. Compassionate leaders shape the environment at the point of care. Yeah, the point of care. So what are the things which is going to be taken, and the availability of materials, availability of things and communications. A proper environment has been set by the compassionate leader. That means she is there to help, or she is there to take care of all the environment which is very conducive for giving care to patients. As such, it is up to them to create a culture within the departments and shows compassion to the patients and that they serve. That means she is also a compassionate leader, also contributes herself in the patient care. The role of compassionate leadership. The compassionate leadership has certain specific role to perform, help people to develop. So this is very, very important. Compassionate leadership to serve people under them, provide advantages from them to develop and grow in an encouraging atmosphere. Here, so that means they have to help. They have to be part of any part of their development. The individual nurse leadership should show the concern, should be part of other individual to come up in the profession. She has to help to develop individuals. So that will give confidence on the leaders so that their work also will be performed well. Help solve problems. Compassionate leadership is to identify problems and then step in to help them to solve their problems. So the compassionate, the main difference is here. The compassionate leader understands the individual suffering and she has the motive to help to solve the problems. As the leader will see that it's part of his or her job to support people working under them in solving their problem. instead of the certain leadership or certain leadership will also always they will find fault or blame that work has not been done in a proper way, or if any problem arises, definitely they have to take that to solve and coordinate with the person who are in need of help. So that is important role of the compassionate leader to do in her clinical settings. Compassionate vocabulary. This is very much important for a compassionate leader. So in this pandemic, we have witnessed and we have read and we have come across, this is very, very important because the way in which we talk, the way in which we bring body language and other things makes others hurt, or we can say that this way. So this vocabulary is very, very important either way, for even taking care of patients or to coordinate with other team members or to the individual nurse who is working under her leadership. So everywhere the setting has to have a very good compassionate vocabulary which helps them to interact smoothly. Compassionate leadership to prioritize compassion in the way he or she talks. Word matters a lot more than people realize. Whether the talks reveal motivation on a positive mode. So here, that's what it is very important. So always the compassionate leader should think and make herself, when she's communicating, should always give a patting or give encouragement, give a hand to do her task in a better way. So that is very, very important, as the vocabulary is. So there is a training in compassionate vocabulary also, which means the leaders, how they have to talk to their subordinates, how they have to come across, and what are the important vocabulary which makes the individual to encourage and do a better performance, the outcome of their activities. Everything is, it goes with the vocabulary, and it is very much needed how we are communicating. Communication skill is very, very important in nursing, which has been very, very needed at this present days. Then cultivate compassion. Compassionate leader to cultivate compassion through action and make it part of the culture to be compassionate in the workplace. As the leader treat people well and they treat other people well, there is like a ripple effect, and over the time creates an environment where compassion becomes the norm. So cultivating compassion. So this is very, very needed, as I was just telling. Leader should, how they behave with their subordinate will make the person to move with others, which means if you do something good, or if you are taking part in an open-mindedness without any prejudice, that will also help and learn from the leader, and they will exhibit. And when the leaders are happy in sharing their experience, this will also help the thing to go. And so here it gives an effect in the atmosphere or in the situation or in the environment, which makes a norm of, that means it is part of, there is no need for us to think and do. It becomes the norm to carry on the role of compassionate leadership in bringing up the changes in the environment. So with these, we have seen the compassion, how much it is helpful being a leader. Here, I just want to mention few things on meaning of self-compassion. So the nurse who is going to provide care also needs self-compassion. That means she has to identify herself being compassionate, and she has to identify herself to be balanced with all emotional needs and other things. As she has over stressed, there is burnout. There is so many things which is happening around. Every day she is just seeing. There is something called compassionate fatigue. The nurses are becoming compassionate fatigue because they are over and over, they are seeing the sorrow and sufferings and other things in her day-to-day care. So it is important for us to practice this self-compassion. What do you mean by this self-compassion? Self-compassion is nourishing one's own happiness, taking good care of physical and emotional health, and setting aside some time each day to send oneself love and compassion, which means they themselves identify and be compassionate, and they have to spend some time for them to realize. Self-compassion entails being warm and understanding toward oneself when he or she suffers or feel inadequate rather than ignoring the pain. So it is very, very important for nurses, especially when we come across a overload of work without expectations or without any preparations. So the importance of self-compassion, forgiving and nurturing oneself can set the stage for better health, relationships, and general well-being. Self-compassionate people recognize their suffering and are kind to themselves at these times, which reduces their anxiety and related depressions. Compassion training helps to worry less and be more open to negative emotions. Compassion improves mental health. So every nurse has to practice this compassionate care as well as self-compassion. Practice self-compassion. Learn and practice self-compassion. So we have to allot some time, and we have to have some time for us to do these things. Work with a supportive therapist or coach. You can't just like that practice as because we are reading, but we have to have learned properly through a coach, and we have to practice. Treat yourself as you'd like to be a child. So you certain times we behave like a child. So that makes us to realize and just gets it away of our own stress and burnout and depressions, everything. So we have to be like, that means we have to be relaxed, and we have to be without thinking any, and we have to be play, and we have to make ourselves engaged with certain things which we like. Always children will like to do things what they like, not what we say. So like that we have to experience and we have to practice. Practice mindfulness. Mindfulness is one of the important thing to practice self-compassion, and it also helps to strengthen our mental abilities, and it helps to go for emotional balance and skills. Give yourself permission to be imperfect. So sometimes when we happen to see people are very perfect and they will not even tolerate the soap dishes of hand washing, during that time is just the position of the soap dish also will not be tolerated by certain people. That type of a constant vigilance should not be there. That makes a stringent effect on our own health. So that also should be, that means we at times we have to be imperfect. That means we have to be very, again it says very relaxed. Be a positive thinker. Always positive thing will bring a positive outcome. So here I just want to say self-appreciation. I just want to say self-appreciation because I am very happy to share myself as a co-speaker with Miss Daini Tham, as she is an empowered nurse. There is no age or experience or education, whatever it is. Empowerment comes, it is only identifying themselves, the strength of their power, and they will be sharing, as I told you, to enable others to understand their strength and be confident in life and profession. Thank you very much for giving me this opportunity. Thank you so much.
Thank you, Dr. N. Jaya ma'am, for explaining us about the need for compassionate care in nursing and the core values of nursing, and also explaining us about the self-compassion, how it should be. And the question and answer section will be done in the last. So now let me introduce the next speaker, Madam Daini Thomas, who has done her RN/RM, BSc Nursing and MSc Nursing, and also the fellowship in ECMO specialist, that is the extracorporeal membrane oxygenation. And now currently she is working as a nursing officer in cardiac cath lab, AIIMS, New Delhi. Okay, her experience and achievements. She has a professional experience in teaching, research, and clinical practice. She's an expert and resource person in national and international forums. She is the secretary of Society of Cardiac Nurses and also the course director of 3 courses organized by SOCN, that is the Society of Cardiac Nurses. She is the QI mentor for 13 QI projects in Cardiothoracic Center, AIMS. She is the educator of the Pan-India Nurse-led clinic for heart failure patient management. She is certified as quality improvement mentor, trainer of the End of Life Nursing Education Consortium, administered by the American Association of Colleges of Nursing and City of Hope in 2019. She has published research papers in national and international index journals and also presented papers in national and international forums. She is the co-investigator in intramural and extramural research projects. She has developed a mobile app, Dhadkan 2, for the telemonitoring of heart failure patients in collaboration with the Department of Biotechnology, IIT Roorkee. And awards and honors. She has received the second prize in quiz competition, CEU TH 2017 in the 7th International CME, and also received the first prize in oral scientific paper presentation, Multidisciplinary Healthcare Conference in November 2016. So I request Madam Dani Thomas to brief us about the nurse-led cardiac rehabilitation, the need for the hour. Over to Madam Dani Thomas.
Am I audible?
Yes,
Yes, ma'am. Yes, ma'am.
Good afternoon, everyone. And thank you, Shiny ma'am, for the warm introduction. And I am very grateful to TNI Delhi, Delhi branch, as well as All India Institute of Medical Sciences, Delhi. That is my parent house where I belong. And I acknowledge both the houses for giving me this opportunity, and I am grateful to Dr. Gopi Chandran as well as the TNA Delhi branch for giving me this opportunity to be in midst of the empowered nurses to empower the nurses. I'm also thankful to the national president, Dr. Roy, as well as Annie ma'am and Shiny ma'am and Bindu ma'am for giving me this opportunity to present a small topic in front of you. So without wasting much time, let me move to the topic. So today I'll be talking about nurse-led cardiac rehabilitation, which is the need of the hour. So why is cardiac rehabilitation needed? I'll just stress the importance of that. Harnessing the power of digital health to improve the awareness, prevention, and management of cardiovascular diseases globally is our goal for World Heart Day 2021. So World Heart Day 2021, it stressed the theme of use heart to beat CVD. So we should stress on beating the CVD by connecting through the heart to select the healthy choices and use heart to understand our risk, like the blood pressure, diabetes, and high blood cholesterol. These are risk factors for CVD. So use heart to understand our risk and use heart to monitor your heart health, like blood pressure, heart rhythm, and sleep apnea. So these are the key themes that was put forward by the World Heart Federation for the World Heart Day 2021. Keeping in this outset, I would like to put forward the burden of CVD. Cardiovascular disease, it is the one of the leading causes of death worldwide, and in India, that is 24.8%, both across the rural as well as urban population. And exercise therapy is a valuable intervention for improving the physical function of older adults with cardiovascular disease and those at increased risk for CVD. So according to the Global Status Report, it shows the global milestones in the prevention and control of CVDs. And in 2013, a WHO Global NCD Action Plan was put forward, including 9 global targets and 25 indicators that has to be achieved by 2025. And it has 9 voluntary global NCD targets, and it aims to reduce the number of premature deaths from the non-communicable diseases by 25% by 2025 through 9 voluntary global targets. And among the 9 global targets, 2 of the targets directly focus on preventing and controlling the cardiovascular diseases. The WHO, the World Health Organization, its vision in the prevention of control of NCDs, it mainly focuses on the prevention, surveillance, and healthcare. That was about the global aspect. And in India, the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke. That was a program, NPCDCS. It was launched in 2010 with focus on strengthening the infrastructure, human resource development, health promotion, early diagnosis, management, and referral. So under this program, NCD cells were established in national, state, and district levels for the program management. And NCD clinics were established in district and CHC levels, and it provided free diagnostic facilities and drugs for patients who attend the NCD clinics. Under this program, cardiac care units, CCUs, are also established in identified districts for emergency cardiac care, and daycare centers have been established in identified districts. And during the 2010 to 2012 period, 100 districts were chosen for establishing the daycare centers across the 21 states. And the program was re-strategized and scaled up, and the entire country has been taken into account in March 2017. So this is about the global as well as national response towards tackling the non-communicable diseases or CVD. And why is cardiac rehabilitation is needed? Cardiac rehabilitation, it is a evidence-based comprehensive intervention for the secondary prevention of CVD, and it is a complex interprofessional intervention. And according to WHO, cardiac rehabilitation, it includes the sum of activities required to influence favorably the underlying cause of the disease, as well as to ensure the patient the best possible physical, mental, and social conditions so that they may, by their own efforts, preserve or resume when lost as normal a place as possible in the life of the community. So why is cardiac rehabilitation needed? What is the need? So if you see the accounts that is given by the International Council of Cardiovascular Prevention and Rehabilitation Global Audit Report, we can see that there is a greatest need for cardiac rehabilitation in India, particularly in the north. And no cardiac rehabilitation setting has been found in rural area, and no location in community hospital. And according to them, there is only one spot for every 360 ischemic heart disease patients per year, with 33 lakh for 4,474 more cardiac rehabilitation spaces needed each year. And they also found that 13.3% of the people only had an individual consultation with a nurse. And women only classes, that is the classes for only women were found in 13.3% amount. So what were the barriers they have found? It was lack of patient referral and the financial resources. So for the cardiac rehabilitation, who all are needed? If we are telling according to the theory, cardiologist, clinical nurse specialist, physiotherapist, a dietitian, occupational therapist, pharmacist, psychologist, smoking cessation counselor, a social worker, all these people are required in a multidisciplinary team. But in India, a nurse is trying to carry out almost all the responsibilities along with the cardiologist. So what are the focus or components of cardiac rehabilitation? First is the patient assessment, nutritional counseling, weight management, blood pressure management, lipid management, diabetes management, tobacco cessation, psychosocial management, as well as exercise training. So these are the components of CR. And what are the indications? A patient who had a recent myocardial infarction, acute coronary artery syndrome, chronic stable angina, congestive heart failure, after a coronary artery bypass surgery, after a percutaneous coronary intervention, after a valvular surgery, cardiac transplantation, and after device implantations like pacemakers, AICDs, So all these are the indications of cardiac rehabilitation. So those patients require a cardiac rehabilitation according to the concept. So what are the types of cardiac rehabilitation available? The traditional center-based cardiac rehabilitation, that is, that was found in a setting like in a hospital. And second is a site or home-based cardiac rehabilitation that can be done in like community centers or like gyms near the houses, like that, home-based cardiac rehabilitation. And third one is the hybrid cardiac rehabilitation, in which both traditional center-based as well as home-based, both are clubbed. And the fourth one is the tele-cardiac rehabilitation that is done through devices like mobile apps, video consultations through the by using the technology. Cardiac rehabilitation is provided by the team. So what are the phases of cardiac rehabilitation? It starts in the hospital itself when the patient is in a ICU, like if a patient had a myocardial infarction and is admitted in the hospital. So when the patient is in CCU itself, the first phase or acute phase starts, and it continues to the center-based. So in the acute phase, what are the activities that we aim to? First is the patient assessment, early mobilization, so that they can at least start walking 2 to 3 steps at the first day or the second day itself. And identification of CVD risk factors. What are the risk factors? And pre-discharge assessment. So these are the goals in the acute phase. And the phase 2 or center-based cardiac rehabilitation, what is required? It starts as soon as the patients are allowed to be discharged, and we provide resources and an environment or a supportive community for the patients to complete their comprehensive rehabilitation program. So maybe the patient may have to undergo 2 to 3 sessions per week for around 8 weeks. And a patient risk stratification is necessary to determine the exercise prescription. So while prescribing the patient for a cardiac rehabilitation, the main thing that we have to keep in mind is the if the patient have any contraindications for CR. Mostly the patient do not have any contraindication, but in special conditions like those require activity restrictions or exercise restriction, like end-stage heart failure. In those cases, the cardiac rehabilitation has to be done with caution. And phase 3 is the maintenance phase, and that can be done at home itself. In that, the exercises are to be integrated into the patient's actual lifestyles to facilitate compliance in this phase. And we recommend moderate intensity exercises, at least 30 minutes, three times per week, or low intensity exercises has to be done for at least 5 days per week. And ECG monitoring is not necessary during the maintenance phase. So this is a slide that shows the recommendations of the American Heart Association or American College of Cardiology Foundation. So they have put forward the secondary prevention and risk reduction therapy for patients with coronary and other atherosclerotic vascular disease. So among these points, you can see the last one, that is the cardiac rehabilitation. So I just put this slide because of the importance of the cardiac rehabilitation that was put forward by the American Heart Association in preventing the cardiovascular diseases. So now you have understood what is the importance of cardiac rehabilitation among the public. So in this outset, I would like to stress my topic, that is the nurse-led clinics or nurse-led cardiac rehabilitation. In the most populous country like India, the doctor-patient ratio is less than the prescribed limit by World Health Organization. To improve the health status of people, there is a need to focus on the primary prevention and maintaining the health at the first level itself, that is in the community. The health education services provided by nurses in the community and hospitals help to make people aware about the acute as well as chronic illnesses. In many low and middle socioeconomic countries, clinics are managed by nurses to overcome the shortage of doctors. Moreover, studies show the evidence that patients are more satisfied with nurses' clinics in terms of cost, accessibility, and timing, as well as clarifying the concerns and doubts of the patients. So, in this point, I would like to tell that I think Gopi sir and the TNA Delhi has taken initiative to find out how many nurses are having the non-communicable disease. A survey was conducted a few months ago, and that was a excellent step taken by the TNA Delhi branch, and I would like to thank TNA Delhi for taking that initiative to assess the health of the nurses, so that how many nurses are at risk of CVD, and interventions can be given for those nurses. This is a paper cutting from 2018, September 17. So it says, as India struggles with doctor shortage, government gives a push to nurse-led clinics. So next, let me say about the different nurse-led cardiac clinics that are being run. The first one is nurse-led heart failure clinic. Next is nurse-led atrial fibrillation clinic, nurse-led INR clinic, nurse-led RSG clinic, and nurse-led MI clinics. So these are few research evidences. A randomized controlled trial to assess the effectiveness of a nurse-led home-based heart failure management program. So it was done by a student from College of Nursing, AIIMS Delhi, Mamta, under the leadership of Kamlesh ma'am and Sandeep Seth sir. And it showed she has worked excellently, and it had mainly 4 interventions, that is health teaching by the student to the patient, and next is the Hriday card, and I'll show the picture. And the third component is a telemonitoring by a mobile app, and fourth one is a phone call by the student. So this is a Hriday card that was given to the patients, and they had to fill the patient details, and the primary care provider or the hospital doctor or nurses details were entered in this, and as well as the patient's vitals like heart rate and BP and weight was entered in the in this card, as well as the warning signs of this was mainly for heart failure patients, and the warning signs of decompensation that was explained in this in the other side of this card, so that they can find out when they are at risk of decompensation and how to take the medications, how to take care of them. Health education was given in the other side of this card. So this was an app that was developed by her, that was known as Dhadkan, and it had details of the doctor, as well as the patient had to enter the blood pressure and heart rate once in a week, and the student received the message from the patient. Like you can see in the right side of the window, the weight, heart rate, and blood pressure of the patient. So according to that, she can, if the heart rate is increasing or if there is a weight increase, then the student will contact them to explain about the lifestyle modifications. That was the research. And second study, the upgraded one, was done under the leadership of Dr. L. Gobichandran, and I am very proud as well as honored to be a part of that project. A randomized control trial to assess the effectiveness of nurse-led structured telephonic heart failure management program among the patients of heart failure. So the Dhadkan app, it was upgraded. The version 2 was made with the help of IIT Roorkee, and the patient can register as well as the doctor can register. And these are the different images of the screenshots. And the patient can enter the heart rate, weight, heart rate, and BP, as well as they can upload the images. Like if they take an ECG in a clinic that is nearby their home, they can upload the image, and the doctor as well as the nurse can view the image. And if there is any arrhythmias, or if the patient lab report has any derangement, then the nurse can call them and explain them what are the interventions to be done and lifestyle modifications to be done. So it was an upgraded one. and the interventions included a structured telephonic follow-up once a week or on the patient demand till 3 months, as well as health teaching was given at the OPD, and the mobile app demonstration was done at the OPD. And if needed, the nurse will refer the patient to the cardiologist. So this is a team, the nurse-led heart failure clinic. It was run by 5 nurses, and it was started on October 2016. And I'm so happy to say that Dr. Gopichandran also was a part of this in initiating this clinic along with Dr. Sandeep Seth. And he had helped so many nurses to get empowered to join this program, as well as he helped us to be part of a pan-India heart failure education program. And I was fortunate enough to be a part of that and visit different hospitals and colleges to teach students regarding the nurse-led heart failure management program. And these heart failure specialized nurses, they provide outpatient services in the heart failure clinic every Thursday, as well as in inpatient services like in ICUs, CCUs, and wards. They follow the heart transplant patients, and they give a pre-transplant checkup, and they refer to different departments, and post-transplant follow-up. That included many activities like drug level checking and their exercises and their physical as well as mental as well as psychological. All the factors were followed up by them. And they also gave home-based management. They used to visit the home of the heart failure patients, and they checked the environment and saw whether it is apt for them to live, because after the heart transplant they have to be under immunocompromised compromised medications. So so they used to visit the home and used to check even the water they drank. So those were the services provided by them, and they have done the telephonic follow-up, and audiovisual clinic was conducted by these heart failure nurses, and they also participated in the research and in service education activities. And that was about the nurse-led heart failure clinic that is running at AIIMS. And second is a nurse-led atrial fibrillation clinic, and the impact of nurse-led atrial fibrillation clinics on patient and healthcare outcomes, a systematic mixed studies review. And it showed that the nurse-led clinic was cost-effective, and it reduced the waiting time, reduced the hospitalization and emergency department visits, and it lowered the mortality rates of patients and higher medication adherence, and it improved the quality of life, and the guideline adherence also increased among the patients. So they concluded there was improved healthcare, quality care, and patient outcomes by having a nurse-led atrial fibrillation clinic. And another nurse-led atrial fibrillation clinic, it showed that nurse-led clinics can contribute significantly in the areas of patient education, sustained follow-up care, improving the outcomes, and addressing the current deficiencies in the AF risk factor management due to the scarcity of medical resources. And another clinic has shown that nurse-led clinic can offer a patient-centered review, because a patient is talking to each individual or the patient for a longer time, and they are following up for a longer time. So they are able to give holistic follow-up and reduction of ischemic stroke or TA, as well as reducing the bleeding complications for the patient. And this is a study that was done as nurse-led approach to improve the cardiac lifestyle modification in an atrial fibrillation population. So American Heart Association, it has put forward the Life Simple 7 score, and it has shown that after having a nurse-led approach, it has improved the weight and blood pressure management among the patients among the atrial fibrillation population. So, so this is a study that was done by Ahmed Gadar, and he concluded that INR clinics managed by nurses can reduce the patient hospitalization, complications, and emergency room visits, and reduce the overall cost. And they can manage patients newly maintained on anticoagulants. So to obtain a systemic process in the clinic, nurses should be well trained and they should follow a pre-printed protocol for managing anticoagulant dosing, and they have to adhere to a follow-up system and patient education. That is important. So if a patient has to run, if a nurse has to run a nurse-led clinic, they should be well trained before starting the clinic. So in this context, I would like to explain about one of our nursing officer who is a PhD scholar from INC, Dr. Nisha Thomas. She has developed an anticoagulant app for the patients who have undergone the valvular surgeries and those who are on anticoagulant therapy. So she's working in AIIMS New Delhi. So, and I am very happy to be share the news here among the empowered nurses. Even when the nurses are in the clinic, I am so happy that they are doing a lot of activities to empower themselves as well as the nurses, as well as the patients too. And also they have done so many activities to empower the fellow nurses also. And this is a study that I would like to explain, the nurse-led intervention for the rheumatic heart disease patients. And this is also done in AIIMS, and this is also done by the same nurse that I was talking about, Dr. Nisha. She has developed a penicillin registry for the patients, for the RHD patients, rheumatic heart disease patients. And according to this penicillin registry, the RHD patients, they have to take the benzathine penicillin injection every 21 days. And they will receive the reminder every 21 days. And before that itself, beforehand, they get the reminders. And based on that, the complaints among the patients were improved. So this is a nurse-led intervention done by a nurse. And this is another study that was done in AIIMS by a postgraduate student, Ms. Usha. So a study to evaluate the feasibility of a nurse-led follow-up clinic among the post-myocardial infarction patients attending the cardiology OP department at CN Center, AIIMS, New Delhi. So this was done under the guidance of Dr. Gopi Chandran. And it has found that the overall inter-rater agreement among the nurse and the senior resident, it ranged from 87.34 to 99.8%. So it's just the how much a nurse can come forward according to as equal as to a senior resident. And she was given proper training and guidance. That's why she was able to do that well. And I think our nurses are so good enough to become such a great nurse. And 86% of the patients were highly satisfied, and only 14% were moderately satisfied. And it was found that the nurse-led clinics was feasible among the post-MI patients after proper training of a nurse. So if it is possible in a tertiary care center, I think this is possible even at smaller health care centers also. So what are the benefits of a nurse-led cardiac rehabilitation? It helps in even empowerment of the nurse as well as the empowerment of the patients. It improves the quality of life of patients. It improves the patient satisfaction. It reduces the mortality and prevent the progression of disease, and reduce the healthcare costs, improve the compliance, reduce the ED visits, improve the self-care adherence, and reduces the hospital stay and improves the patient outcomes. So what does the nurse do in a nurse-led clinic? They do history and physical examination, they do patient assessment and identify the health needs and do the appropriate referrals and recognize the early clinical features of worsening condition, initiation of diagnostic tests, promote the medication compliance, promote the self-management of different diseases, and optimize the medical therapy, prevention of complications, promote the lifestyle modification, follow up, as well as scheduling the frequent hospital visits as needed. So these are the benefits of nurse-led clinics. So after telling all this, what are the barriers of cardiac rehabilitation? Why it is not up to the mark in India? So mainly it is financial and lack of understanding, motivation, and interest among the patients as well as the physicians. A patient work or time conflicts because it needs compliance, and the patient has to come for cardiac rehab. They have to take time. And lack of physician support or referral, and illness of the patient, transportation difficulties, sickness of patients, embarrassment about the group activities, because they have to undergo different activities, and age, older age, as well as females, and the patient's beliefs about their illness, patient's expectation about the cardiac rehabilitation, feelings of self-efficacy, mood and coping style. These are the barriers found according to a study. So what is the way forward? What can we achieve through this talk, through the empowered nurse for a empowered nurse? So what I would like to say is, in this era, we can have tele-rehabilitation, and we can incorporate artificial intelligence in cardiac rehabilitation, examine the role of technology in delivery of nurse-led clinics in rural as well as remote areas, and cardiac rehabilitation within the safety limits, like by using telephone, text messaging, emails, video consultations, web-based platforms and applications, and tele-video guided CR. So, and I think even by having a virtual meet like this, the people from rural area also can have proper training with the with the experts, and they can also start the nurse-led clinics even in the rural area. To conclude, a cardiac rehabilitation program led by a nurse can significantly improve the health behaviors and cardiac physiological risk parameters in CHD patients, and nurses can fill the significant treatment gaps in the risk factor management of patients with coronary heart disease. So with this, I would like to conclude, and let's all be empowered, and let's all be confident and prepared to meet the need. Thank you. Thank you, TNA Delhi, for giving me this opportunity to share my views in this platform. Thank you.
Thank you, Madam Danny Thomas, for explaining the importance of the nurse-led cardiac clinic. Due to short of time, I'm just requesting Madam Alka Mishra, who is the EC member of TNA Delhi State Branch, and also the chairperson of the public health sector, to lead us, take the question and answer session, followed by vote of thanks.
Okay, thank you,
madam.
Okay, thank you, Shiny ma'am. So we received a question from Mr. T. Lamo for Jaya ma'am, and he is asking, how do you apply the concept of altruism in nursing, and in what context? And also he requested that it should be explained with instances.
Ma'am, can you keep your mic on? Jaya ma'am. Yeah.
Yes. Altruism is one of the core values of nursing. So nursing has been originated on this type of core values. And when we practice in nursing, it is very important that we are taking care of patients, and it is that we are not getting back anything from them. That means we are part of their health promotion, recovery of illness, and we are here to practice this. In turn, I can just say this is a professional attitude by nurses to maintain or to have the altruism in their professional activities. And when I say this professional, activities, so we have our routine care of nursing, taking vitals and recording BPs and all other things. The same way, there's elimination issues, and whether we are in a position to go with the sanitary issues and other things. Here, I just want to say, so this nurse has to be compassionate, as I told you, or she has to exhibit herself. There is no facial or the attitude towards the patient or whomever she's caring should be satisfied of her activities whatever she is doing, including the sanitation, sometimes it may have a difference of certain things with the patient as well as the nurse. So that should be avoided. So she has to exhibit a professional attitude. It goes together with that. And I just want to say, simply when we mean this, just how to go with practicing our own self. So for example, if I give an open way, if you buy a cup of, 5 cup of coffee, if you are paying the total money to the vendor and you are just suspending 2, that means without knowing or any unknown person when they come, with their need, it has to be supplied. That means the individual is not knowing who is the other person going to be benefited out of his cost, but still he is having the intention or the mind or the attitude to help others. The same way nursing is based on this. This is an outside example, but I just want to give so many examples in our day-to-day care itself is based on altruism. That's what it is. Professional attitude to be exhibited. It has to be kept in mind for all nurses.
Thank you, ma'am. Mr. T. Lamo has another question, and that is, what's the difference between how can we differentiate between self-appreciation and self-boasting?
Self-appreciation, yes. When not only in nursing or by individual yourself, we have to recognize and we have to identify our own strength. That is one way of, as we are just discussing about empowerment, that empowerment itself is self-appreciation. And when we are just recognizing our strength and we make us to have control over our own life is self-appreciation. You have to have, if some friends are there for you, when you are just getting some award or when you are doing some patient care, which you feel yourself more satisfied of taking care, because you have in return got that appreciation or acceptance from your patients who have recovered very well from the illness. So that type of satisfaction has to be again and again we have to think so that it will make us to go for a better shape. On the other hand, self-appreciation makes the individual to be very confident, and self-appreciation boosts the individual. Self-appreciation makes to have all cooperation, coordination with one another. The best relationship will be developed by self-appreciation. Self-boosting without any truth or without the actual thing which is needed. Whenever you go for doing something for as an help or a care ward, you have to have without any expectation, but you do nothing, I can't say, but you do something which is not very relevant to the need, but you say that you have done this, that and all, is self-boosting. That is not going to have anything. It is no way it is going to help to develop an individual. This self-appreciation helps to develop further right in their own life as well as in profession. So every individual has to appreciate. So today I can have my self-appreciation that I have been, as I told you, this empowerment after so many years of my experience gave an young mind of Dani and sharing her experience. So this type of, this is in turn professionally we are as seniors. I was just thinking. So as seniors, we have not been carried out so many things, but now the younger generation are ready to take up and ready to do things that is very much appreciated by others. And in that sense, I will say self-appreciation is one which makes the individuals to grow.
Thank you, ma'am. It's very well explained. Just now, we received a question for Dani, ma'am. So, she is asking that what are the procedures for registering for nurse-led clinics, and do we need to register somewhere, or?
First, the nurse has to take a proper training from an expert. Like in our hospital, the heart failure specialist, that is Dr. Sandeep said, he has given special training to the nurse to the nurses, and they were given special training, and after that they have started the nurse at heart failure clinic. And regarding the PhD scholar that I was talking about, she has done self training, like she has taken self study, and after that she has started, and under the guidance of Professor Anita Saxena, that is the HOD, head of the Department of Cardiology. So under expert, the person has to take a proper training, practical as well as theoretical, and then you can start a clinic.
Okay, thank you so much, ma'am.
I hope I answered your question.
Yeah, ma'am, I think it explained or cleared the doubt. Since we don't have any more questions, so moving towards vote of thanks, I would like to extend my sincere thanks to Jaya ma'am for her valuable time, and she explained very well the importance of small gestures and communication to show our compassion towards the patients, and also essential skills which are required for nurses for providing compassionate care, and how compassionate leadership helps us in, our mentors, if they are compassionate, how they can shape individual nurses based on their strengths and weaknesses. Also, I would like to thank Ms. Janie for enlightening us with the overview of CVD, national programs, goals, and responsibilities, and what are the needs for cardiac rehabilitation, its types, its components. And she also introduced us to this app which she actively developed, that is Dhadkan 2. And she explained very well how this app works. And she also gave us an overview of nurse-led clinics and how nurses can fill the gap in care of cardiac patients. I also take this opportunity to thank Annie Madam for her constant support and encouragement. And I would like to share that we, TNI Delhi branch is very proud that our president, Dr. Gopi Chandran, received National Award 2021 for e-governance by Union Home Minister, and also his ICMR funded research selected for National Award. So it's a very proud moment for all of us, and congratulations to you, sir. And I would also like to thank Ms. Shaini, Bindu ma'am, and Dolma ma'am for their constant efforts to make this webinar series running very successfully. Thank you, everybody, all the participants and all the office bearers who spared their valuable time to attend this webinar. Thank you so much.
Yeah, thank you, Alka ma'am. And I could say Janak ma'am, who is the Vice President of South TNI. So thank you, ma'am, for joining, and many eminent speakers were there. So I cannot call everyone. And thank you, Annie ma'am, also for taking out the time, and she was there for the whole session. So thank you all once again. Have a blessed day.
Thank you. Thank you, everyone. Bye.